Hello, you're welcome to another edition of my program called Health Talk with Queen Nikki. How you guys doing? Okay, so what's going to be our health topic for today is going to be management of allergy. Yes, as we are approaching allergy season in Western world, and don't get me wrong, people will be like, oh, okay, what does allergy have to do with people in Africa? Yes, it has a lot. Okay, let's talk about it. So what is allergy reaction is when you eat something or you come across something, and then your body reacts to it. That's the simplest way I can explain it, but that's not where I am going to. Where I'm going to is, what are the signs when you see on an individual? I'm going to be combining both adult and children reaction to allergy in this video. Okay, so when you see adult and children do this, especially for those people living in abroad or even in Nigeria, they do the look. I'm sorry for the manner of what I'm about to do. That's the only way I can demonstrate it. Like, they itch their throat, they put their hand in their hair, and they do this. Yeah, that's the significant, typical sign that the person is reacting to allergy. Okay, their throat itch so bad, they have watery eye, runny nose, itchy nose, and sometimes you see them do the, and they do the sound very well, okay, because that's the only way they can eat their throat, and sometimes it grows to some people, but hey, they are reacting to allergy, and you see them, they become heave, sometimes they change color. For those people that are light skin, you see their color change, and sometimes they have shortness of breath, wheezing, and difficulty in breathing in some intense situation. Like you see them wheeze so bad, especially in asthma patient. You see them now. So if you see this typical sign, what are the things that can cause allergy reaction? It can be due to your food that you ate. Especially the little kids that are under 1 year old, if you are introducing them to food, be careful. Do one food at a time, because you don't know the food they will be allergic to. Okay, you can be allergic to medication. You can be allergic to food or pollen outside. If the flower are dropping or they are growing, or during change of weather, you can be allergic to that. So how do we manage allergy reaction? Number one, drink water. Yes, drink water, especially if your room is dry. Drink a lot of water consistently. It will moisturize the mouth behind your mouth. And also make sure you humidify your room. They have a lot of humidifier that you can buy. Just put it on, especially at night where the room is so dry, the hair is so dry, so it can moisturize the room. Secondly, we have you can also treat allergy reaction by using medication. I don't like mentioning medication on my program, but for the purpose of this, I will mention they have over-the-counter medication that you can use, and also prescription medication. If the allergy persistent, please call 911 or go to the emergency room or your doctor's office. Tell them. They will do what we call allergy testing to know which particular allergy, I'm so sorry, that you have allergy to, so they can give you allergy medication for that. Okay, so now they in some intense situation, there's what we call EpiPen, which the doctor might prescribe to you, and you will hold it. So when you start having allergy reaction, the doctor will tell you to give yourself the injection to reduce the reaction. They usually give people that have like severe allergy, and also with medical condition that require them to have it. Okay, so talk to your doctor. That's the best way. This video is purpose of education, but the most important thing is your doctor advice and also your doctor instruction on how to reduce allergy reaction. Okay, then another thing you can do, especially for those who travel, is allergy band. What we call allergy band. You can get it all over the store. You put it on, and then you write the things you're allergic to, so that if you start having the reaction, they know what to do once they see it. Especially in the Western world, we nurses, if we're running by a patient on the street or in the party or wherever we have, once we see that, we'll know that, okay, this person is allergic to this. So and also it's good for the children when they are going to school, especially those ones in the daycare. It's very, very important. Once you notify the nurses, school nurse, or the teacher, for those people that are in Africa country, you will notify them, and also make sure you have the allergy ban, so that way we can know that the children is allergic to this particular thing or this particular food, so we don't bring it close to them, because it can be severe. Yes, it can be severe. It can lead to pie. I don't want to say because of TikTok. So knowing the allergy is very, very important. Okay, let's go. Now, for adults, let's continue. If you're allergic to certain food or medication, avoid that food. Avoid anything that contains that food or the medication. Use another class of medication entirely, or avoid that food entirely until your doctor until your doctor retests you to make sure you don't have that same allergy anymore. Okay, it's very, very important. Let me use an example. For children in school, when they are allergic to peanut, there are some peanut food that is containing peanut that the teacher or the school will give the children. Unknowingly, or they share it among themselves. That's why it's very important you let the teacher know, or the school food people know, so that way they can make sure that the friend, children, they share food a lot, to avoid that food, because some people, even smelling the food, make them to have the allergy reaction. Okay, let's continue. For asthma patient, I've done a lot when it comes to asthma. Go to my YouTube channel, you see a lot. For asthma patient, this is the period that you need to be very careful when you are going out because of allergy. Okay, so now the best thing I always recommend for people, or educate people, is put on masks during pollen. When the pollen is very, very high, you put on masks when you're going out, coming in. Wash your hand very well. It's very, very important. Wash your hand, put on masks. Okay, very important. Once you follow that, you should be good to go. And now, if you're having persistent allergy reaction, and you've used medication, you've avoided all those things that I've mentioned, and it still continue, or you're wheezing, you're having shortness of breath. When I say wheezing, let me demonstrate wheezing. Like, you see? Yeah, that's what we call wheezing. Once you see somebody breathing that way, know that danger. The person needs to see the doctor immediately. Okay? Now, once you see that, please make sure that you take it serious. You take it, it's a serious emergency situation that you need to take serious. Okay? Now, let me give an example. Now, allergy reaction, this is very important, can come in form of, like, when you eat peanut, like, for example, you notice that your mouth become itchy, swollen. You have swollen face, swollen feet, or swollen eyes, or whatever you use. Like if you go to pedicure, I have somebody that went to do a pedicure and her hand was swollen. Definitely it's reaction. Please call your doctor. Call your doctor for intervention. I hope this I've learned. If you need more, I can still come back and do more when it comes to allergy reaction and management. With this little information, go to platform that they can educate you more, or YouTube, or read books about it. The best bet is follow your doctor, direction, and also teaching. Okay, till I see you guys in my next video. You see this plus button if you want more health video. Follow the page, Health Talk Queen on TikTok, Health Talk Queen on Instagram, Health Talk Queen 1 on YouTube. Follow, like, subscribe, and turn on the post notification. Till I see you guys, remain blessed. Bye-bye.